Hysterectomy. Introduction. When a woman becomes pregnant, the baby develops in the uterus. Select true or false. Correct. The uterus is able to increase in size as the baby grows. Hysterectomy is a common operation for women and is indicated for several conditions. Select true or false. Correct. Hysterectomies are one of the common operations for women. They are generally considered to be a major operation, however, they are relatively safe. After a hysterectomy, you can never become pregnant again. Select true or false. Correct. After a hysterectomy, you can never become pregnant. If you plan on becoming pregnant in the future, make sure to inform your healthcare provider about your wishes. Are heart attacks and other anesthesia-related complications common during and after this operation? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have had, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Are infections very common after surgery? Select yes or no. Correct. Infections are not very common, and a serious infection is rare. Though rare, a serious infection may still occur. After a hysterectomy, sexual pleasure is decreased. Select true or false. Correct. Women whose conditions caused pain during sexual intercourse report a more enjoyable intercourse. It is common for a hysterectomy to cause stool to leak from the vagina. Select true or false. Correct. This complication is rare. Though rare, it may happen. If it happens, it can be repaired by another operation. After a hysterectomy, you will no longer have periods. Select true or false. Correct. Menstruation or periods occur when the inner lining of the uterus is shed to the outside. When the uterus is removed, there will be no more inner lining growth to shed out. After a hysterectomy without removal of the ovaries, you will still have premenstrual symptoms, PMS. Select true or false. Correct. If you have a hysterectomy, you will still have PMS. If the ovaries are removed during the hysterectomy, which is also called total hysterectomy, you will not have PMS. Thank you for using Explain.